Hello, friends and dear parents. I am Dr. Beena Johnson, developmental pediatrician and senior consultant in child guidance. Autism spectrum disorder is a developmental disorder characterized by persistent deficits in social communication and social interaction, as well as restricted, repetitive, or stereotyped patterns of behavior, interests, or activities. Parents should be given awareness regarding the early signs of autism. Early detection and early interventions are very important in the management of autism spectrum disorder. If we intervene at the earliest in the toddler age, that is from 1 to 3 years, significant improvement occurs and children have acquired age-appropriate communication skills, social skills, and behavioral skills within about 2 years of parent-mediated early developmental and behavioral interventions. First, I will explain the warning signs of autism. Very early signs of autism are the following. These children avoid eye contact from infancy. They have inadequate social emotional development in infancy. They do not respond to their name by 12 months of age. And they do not point at objects to show interest by 1 year of age. The vision and hearing will be normal in these children. Very early parent training interventions can be started at the onset of these warning signs in infancy or early toddler age. Child will develop the social emotional skills, language skills, and behavioral skills within a few months of scientific parent-mediated interventions. Now I will explain in detail the signs of autism spectrum disorder in children. These children have significant deficits in social emotional reciprocity and deficits in developing and maintaining social relationships. These include lack of social play, reduced or absent social interaction, that is, these children do not initiate a social interaction and they do not respond to social interactions. They do not try to establish friendship and there is lack of interest in peer group. They do not respond to the social approach of parents or other children. And there is failure of normal back and forth conversation. They usually insist on playing with fixed rules and they prefer solitary activities. Remember to subscribe this channel. Press the bell icon to get all the updates from the channel Best Child Development and Parenting. Children with autism spectrum disorder will have persistent deficits in social communication. Children with severe autism will not talk at all in their life. About 25% of children with autism spectrum disorder may have some words at 12 to 18 months of age, but they lose these words after that. The other children might speak, but there will be lots of problems related to communication. For example, they may have repetitive speech or echolalia and stereotyped use of words or phrases. They usually reverse the pronouns. For example, they say you instead of I. And they usually talk in robot-like voice. They have ritualized patterns of verbal behavior, for example, repetitive questioning about a topic. The deficits in nonverbal communicative behaviors are the following. Impairment in the social use of eye contact. In severe autism spectrum disorder, eye contact will be absent. They have impairment in the use of body posture. For example, they move away from a listener. The gestures and facial expressions, according to social situations, may be totally absent or reduced. For example, they do not wave bye-bye and they do not nod when we talk to them. There is lack of pointing, lack of bringing objects to share interests with others, and there is failure to follow another person's pointing even after 1 year of age. Restricted repetitive patterns of behavior or activities are also seen in children with autism spectrum disorder. They may have simple motor stereotypies like hand flapping, finger flicking, or finger twisting. They may also show stereotyped whole body movements like swaying or spinning. They can have intense body tensing movements. Repetitive use of objects, for example, spinning coins and lining up toys, are usually seen in these children. They may have attachment to unusual objects like rubber bands or strings. They have excessive adherence to routines, and they show distress during trivial changes in routine activities. Many children with autism have fascination for spinning or rotating objects. They may also have abnormal motor signs like walking on tiptoes. Some children with autism spectrum disorder show repetitive behaviors like head banging or biting the wrist. Unusual visual activities like repetitive looking at objects out of corner of eyes are also seen in these children. The children with autism spectrum disorder may also have inappropriate expression of emotions like laughing or smiling out of context. That is, they might laugh or cry at unusual times or show no emotional response at times when we expect a response. In parent training interventions, scientific information is provided to the parents regarding the child's specific needs, and the therapies are provided which is unique for that child. Thus, each child gets individualized interventions tailored to the child's specific needs, which leads to significant improvement in these children. Early, intensive, and individualized parent-mediated developmental and behavioral interventions are the key interventions in the management of toddlers with autism spectrum disorder. Parent training interventions are also very effective in toddlers with autism spectrum disorder. Thank you all. Kindly subscribe this channel for future updates on best child development and parenting.